Okay. Hello, everyone. Good evening. So, welcome back to yet another session. So, today we are going to talk about hypnosis and how it can help into pain management. So, today I have with me Dr. Buddhadev Nath, all the way from Kolkata, and he is a clinical psychologist and a hypnotherapist also. And he was an ex faculty of Bakura Medical College. So, hi, doctor. How are you? I hope you are doing great. Doctor, am I visible and audible to you?
Yes, yes, ma'am.
Okay. So I hope you are doing well.
There is some network issues. Okay, no problem. Okay, thank you for
Oh,
your nice introduction and welcoming me. So there is some network issues, but no problem.
okay. So I want to know one thing, like as you are a hypnotherapist, so what exactly is hypnosis?
Hypnosis basically a mental technique or a brain-based technique that helps to reduce the brain wave. That is, hypnosis is a profound relaxation technique in which we can make a suggestion that patient can accept and act accordingly. So hypnosis is 100% scientific and it is very easy. And if you want to be hypnotized, then I can only hypnotize you. Otherwise, I cannot.
Yes, yes. If someone wants to get hypnotized only. So, just wanted to know one thing, like who can practice hypnotism? Like, is it everyone who are into the field of clinical psychology or into the field of psychology or therapy can practice hypnotism, or is there any certain like board or university which certifies hypnotherapist?
Yes, yes. It is a very valid question, and everybody should know about this criteria and about these practitioners. Hypnosis is recognized by WHO and also Ministry of Health and Family Welfare, Government of India in 2003. As per the government notification, they have clearly stated that any licensed healthcare professional can practice hypnosis after acquiring training on hypnosis. Here, any licensed healthcare professional includes physicians, psychologists, dentists, and physiotherapists. So these are the categories they can use hypnosis with their practice. But there is a but. They have they must have obtained a university level training on hypnosis. Currently in India, there are two universities. They are offering 1 year PG diploma in hypnosis after post graduation. Okay, so the university are MS University, Baroda, that is in Gujarat, and there are another university in also in Gujarat. The name is Charotar University of Science and Technology. They are offering this hypnosis course through hypnosis course for the professionals only. So one can practice hypnosis after acquiring these diplomas from university after they have already registration with the healthcare council or any other competent council. So this is the primary portion for hypnosis.
Okay, okay. So I just want to know one thing. Like people have a notion that hypnosis means whatever is shown in CID, that there would be a crystal ball and a thread, and the hypnotherapist is going to do like this, and we are going to get hypnotized. So there are such so-called myths. So could you please address what are the myths associated with hypnotherapist or with hypnotism?
First thing that hypnosis is 100% clinical. If someone has some clinical issues or some emotional issues or some socio-occupational issues, then only it will help. Number one. Second thing is that hypnosis is nowadays using at the as the medical tool by the medical professionals and dentists. So this is the basic thing that hypnosis is a medical and scientific tool, and it is number one. Second thing, everybody can be hypnotized. Everybody can be hypnotized if they wanted to. This is the second criteria. I cannot hypnotize you until you are not willing to do. So this should be clearly understood that hypnotize is very easy, and hypnosis is 100% safe. It is not harmful. It is not harmful. And hypnosis means a receptive stage of accepting the suggestions only. Hypnosis is a state where barriers are removed, where rejections are removed. If I am talking, if I am telling you that this is right now, this is night, this is night, you cannot accept, you can deny, because you have some awareness of the time. But when I am hypnotizing you, that time you could not recognize that it is day or it is night. You are accepting only my words. So this is the hypnosis. And hypnosis, third point, third myth, that hypnosis is like black magic or like anything. It is nothing. That hypnosis is scientific process, and it has lots of evidence that hypnosis can work. In India, there are two associations related to hypnosis. One association, very oldest association, that is, it is called Indian Society for Experimental and Clinical Hypnosis. It is very old association of in India, and the new association that is known as Academy of Hypnosis. So two associations are working on hypnosis. They are organizing international conferences. So first conferences was in Gujarat at the Charosar University, and the next conferences will be held on Pondicherry University in coming January 2025. So this hypnosis is very much upcoming in India, and lots of healthcare professionals are attaching with this practice, and that's the important. And here is the needs to remove the social stigma, social taboo related to hypnosis in the society. So that's why hypnosis is very much important. We should start accepting this magical science, these miracles. So these are the myths.
Okay. So, doctor, as the topic suggests that transforming chronic pain into relief, so what according to you is pain?
Okay. So first, we have to understand that pain has always physiology and psychology component. Pain is not due to the 100% physiology or due to the 100% psychology. They are combined. If we are using, if we are using some physiotherapy, some occupational therapy, or some any body work therapy, we are using to relieve from the pain. But every pain has the psychological component. That means the perception. It is also known as pain memory. So, if someone has experienced sciatica, pain like sciatica is a severe pain. It can be it can be at the leg region, mainly calf or thigh region. So, if anybody experiencing this pain can be memorized, can be kept at the brain level as the pain memory, and this pain memory is directly linked with the emotions. So when someone is suffering from pain, pain can be acute or can be chronic. So chronic pain is, there is nothing 100% management, nothing to do with the 100% management. So there are some lacunas. So there are some pain sensation during the work or during the daily life activities. So so there is needed some tuning at the brain level. So hypnosis can lowers the pain sensitivity, pain intensity. Hypnosis can lowers, there is a lots of research. And chronic pain, if there is a chronic pain, hypnosis will increase the coping mechanism of that individual. So this is very much important. So hypnosis will help to manage the pain in three ways. Number one, first it will reduce the brainwave. If during the pain time, the brainwave can goes up to the beta or gamma, and hypnosis can lowers the brainwave up to theta. So we can say that hypnosis is a theta activity. Theta means the brain activity that can be measured through EEG. It means 4 to 6 hertz. 4 to 6 hertz, there is theta. And gamma means more than 30 hertz. So when someone is experiencing the pain, the brainwave can goes up to the theta. That means the slowest brainwave, that is 4 to 6. It can be done by the hypnosis, number one. Second, hypnosis can improve the coping skill, how to live with the pain. Every alive person can experience the pain. Dead person cannot have pain. So if we are alive, it means we have to accept our pain. We have to accept our pain because we are alive. That's why we are alive. So alive person having only pain, no dead person, dead body does not have pain. So this can be coped up with the help of hypnosis. This is the second point. And the third one, that is suffering, pain and suffering is the either side of a single coin. Okay, so pain can be compulsory. Pain is compulsory, but suffering is optional. So these suffering component can be altered with the help of hypnosis. So if I am addressing the physical pain only, then management then management will be not in a complete mode. That will be in half care mode. Then completely with the integrated or holistic model, then hypnosis has great role. That's why hospital likes hospital likes there are so many universities, they are researching on it. And there are other hospitals also, they are opening the OPDs at their hospital department to serve the patient with pain. So hypnosis has effect on pain. So this is the chronic pain. And chronic pain of has the history of lack of sleep, lack of sleeplessness, and lack of energy, lack of enthusiasm. So this sleep issue can be targeted, can be intervention with the help of hypnosis, because hypnosis is also a sleep like phenomenon. It's a sleep like phenomenon, so it can be improved with the hypnosis. So that's the relationship between pain and hypnosis.
Okay. So if someone comes to you and asks that what duration or what would be the duration of hypnosis along with pain, so what exactly the answers goes from your side? Like কত duration হতে পারে?
So in single session, so there should be a assessment. An assessment should be done before start of the treatment. So assessment means what? Assessment means assessment of pain and assessment of coping skill and assessment of level of happiness. So it is very much important. So pain and happiness are the closely related, just the opposite. If someone is happy, then pain will be less. If pain will high, then they are not in happy mode. So first we have to assess the pain level, the coping skill level, and the happiness level. We have to assess. Then I have to assess that suggestibility. It is the very much important that patient is ready to receive suggestions or not. If if he or she is ready to receive the suggestions through the hypnosis, then it will easier for a hypnotherapist to conduct a session. Usually after assessment, there can be a 40-minute to 1 hour session, and for one session. And in a chronic pain cases, there can be 4 to 6 sessions. And in a research showing that hypnosis is more hypnosis is more better than CBT or REBT in producing results. If for the pain management, if CBT takes 10 sitting, then hypnosis will take only 3 sittings. So hypnosis requires less sittings than the other therapies. But CBT is also important. Some patients are not ready to take, not ready to receive hypnosis because they do not prefer. We should not force them to receive hypnosis. Then we can use CBT or any other therapies. But if subject or the patient is ready to receive, then the first choice will be hypnosis. So this is the very interesting fact about hypnosis.
Okay. So my last question would be, doctor, that what is the neuroscience behind hypnosis induced analgesia? Is there any neuroscience behind that? If yes, so what would be the neuroscience?
Yes, yes, yes. Very nice question. So thanks for the question. So
Doctor, your voice is breaking.
hypnosis
Abhi.
is 100% brain science, is 100% based on anterior cingulate cortex. Anterior cingulate cortex is the area of brain directly affected by the hypnosis. So this is the area ACC, anterior cingulate cortex. So this is the area we have to influence that area with the help of hypnosis. So hypnosis means the reducing the brainwave. So brainwave can be classified into gamma, then beta, then alpha, then theta, and the last one is delta. So currently our brainwave is in gamma level. When we are in resting state, when you are in restless state, and we are in relaxed state, our brainwave will be at the beta level. And when we are in relaxed state, our brainwave will be at the alpha level. And the theta is termed as the sleep. and the delta is deep sleep. So hypnosis is the procedure to lower the brainwave by producing physical relaxation first and then mental relaxation by cut off the thinking level, because experiencing and feeling is the process is the process to relax our mind. Thinking means we have, if we are think more, our brainwave also increasing. Okay, will also increase. Then our suggestion, then our instruction to the patient will be that you should follow the instruction and you must experiencing, you must experience that one. So this is the basic thing about the hypnosis. And other thing, that is neuroscience has directly related with the hypnosis in this way. Brain and spinal cord is the continuation of it's a same structure, and both brain and spinal cord forms the central nervous system. This central nervous system has peripheral nervous system and the autonomic. Total nervous system has the central peripheral autonomic. So autonomic has sympathetic and parasympathetic. Okay, so increase of pain is a sympathetic nervous system function. Okay, and hypnosis, that's why hypnosis is called parasympathetic nervous system function, because hypnosis will activates the parasympathetic autonomic nervous system. Okay, so this is the very very miraculous and very hidden part of the secrets of hypnosis. And it is very much effective, very much powerful, but it is safe. It is safe. It is only safe when it is done by a experienced and as well as trained person. That's why hypnosis is safe, and it can be dangerous if hypnosis is introduced by any other untrained or any unprofessional manner. So it is very much important.
Yes, like you said, right, that if untrained any individual is doing, it can be too dangerous. So we are on time, Doctor. So thank you so
Yes.
much, Doctor, for coming up as a guest and talking about hypnosis along with pain management, because it needs to be catered. Because people generally have a notion that hypnosis means a crystal ball would be there and a thread, and before you, it would be doing something to and fro, and you are going to get hypnotized, and then you can commit
Yes.
crime or you can murder someone. Because I kept on hearing all these things, and I came back in some conferences in Kolkata. So thank you so much, Doctor, for coming up and talking about this hypnotherapy, the mechanism and the neuroscience behind this, and the alpha, beta, gamma, delta wala thing. So thank you so much, Doctor, from the bottom of my heart. So I wish I could continue the session on hypnosis, but unfortunately we would have to end the session due to time constraint and as doctor is too busy. So thank you everyone for bearing with us. I'll see you all off in the next session. Till then, have a good day. Tata, bye bye, good night.